Untreated tooth decay causes pain and infection. Untreated tooth decay can lead to poor nutrition, lack of school readiness, and speech problems. Gum disease is also associated with diabetes, obesity, and cardiovascular disease. About 1/3 of California elementary school children have untreated tooth decay. San Luis Obispo County has a similar story. A 2004 study of Paso Robles school children found that 51% of kindergarten and 66% of third-grade children had a history of dental decay. These statistics are disturbing because almost all oral diseases can be prevented. Hundreds of children in San Luis Obispo County suffer from rampant dental decay. This child has loose, decayed teeth and infection around the primary teeth in his gums. He is just one of many severe cases seen during a recent dental screening.
Unfortunately, we see quite a bit of decay and some pretty extensive things. As the cavities get larger, they get into the nerve or the pulp, and then it travels into the bone. So unfortunately, on a pretty routine basis, we see lots of localized infections, cellulitis, and quite a bit of pain, unfortunately.
We see every day, I would say 3, 4, maybe even 5, 1 to 2-year-olds with decay starting, and that can vary in severity from a couple of cavities starting on the front teeth to almost every tooth in the mouth.
During the year, hundreds of children are flagged for dental needs during routine health screenings. However, for a variety of reasons, many low-income children and their families have been unable to access necessary treatment. A year ago, this little girl had minor problems. A year later, at a recent screening, her decay has progressed significantly. She should have 4 front teeth. Instead, the extensive decay has destroyed her teeth, leaving the nerves exposed.
There's a lot of children that have just been living chronically with this pain for so long that they don't know any difference.
It's interesting, many times we've talked to parents after you've been able to treat all the decay and do the extractions or whatever needed to happen, and parents will say they're eating better than they've ever eaten, they're sleeping better through the night. We can't remember Johnny ever doing that before, and so unfortunately I think it is quite debilitating in some instances. In some instances I think that's just all they know.
In San Luis Obispo County, there are nearly 12,000 children on Denti-Cal. Less than 35% of these children were able to see a dentist in 2006. Compounding the problem is the lack of oral health education and other preventive approaches to advancing children's oral health.
The parents don't know a lot of things. They don't necessarily know that the children don't go to sleep with a bottle. They don't know that they shouldn't be drinking juice out of a sippy cup all day long. They don't necessarily know that kids under 5 or 6 need help brushing their teeth.
Some people would assume that everybody knows, that teeth need to be brushed and flossed, and certain kinds of foods you need to eat and other ones you need to avoid, but we find that's not true. Sometimes children will come in and you always ask the parent, how's your child's teeth? Are they okay? Yeah, they're fine, no problem. And they open their mouth and you're just amazed at the number of problems that you see, including abscesses, and the parents just consider that to be normal. So there's a great lack of understanding, I think, by certain groups of people, and we have a big educational job to do, not just over the preventive things to prevent decay from occurring in the first place, but how you treat it once it occurs.
The state of children's oral health and access to dental care in San Luis Obispo County is a serious challenge. The good news is that most oral disease is preventable. Together we can make great strides towards fairness and access to dental care and better education regarding oral hygiene habits.